My dear students, because of corona crisis, we are not meeting each other for a long time. Our today's session is very important for examination or also for clinical practice in future life. Let us start with the case summary. Khadiza, a 3-year-old female child, presented with fever, cough, and respiratory distress for 3 days. She had toxic loop, tachypnea, respiratory rate 64 per minute, chest in drawing, apex beat in normal position, central trachea, dull on percussion on the right side, bronchial breath sound, and increased vocal resonance on the right side, and WC count showed 16,000 per cubic millimeter with neutrophil 78% and C-reactive protein 96 mg per liter. And X-ray chest showed consolidation in right upper, mid, and lower zones of the right lung. And this is the X-ray. You see the consolidation affecting the right upper, mid, and lower zones. So the diagnosis is Lobar pneumonia on the right side. So as I say always, a child coming with cough and respiratory distress, what are the differential diagnoses? If the child is small, the diagnosis is bronchiolitis, and another diagnosis is pneumonia, and if child is old enough, the diagnosis is asthma. Our today's session is on pneumonia. So this is the respiratory tract. It has upper tract and lower tract. Upper tract includes nose, paranasal sinuses, the pharynx, and the portion of the larynx up to vocal cord. Lower tract includes the portion of the larynx below the vocal cord, trachea, bronchi, bronchioles, and alveoli. And the pneumonia is the disease of the lower tract. And this is upper tract, larynx and upper portion, and the lower tract below the larynx. Now, how to define pneumonia? Pneumonia is the inflammation of lungs caused by bacterial or viral infection, in which the air sacs are filled with pus and may become solid. Now, what is the case definition of pneumonia? It is characterized by fever, signs of respiratory distress, coarse crackles on auscultation, and X-ray. There is consolidation or pathogenesis. X-ray is must for the case definition of pneumonia. Now, what is Lobar pneumonia? A pathological state of lung where the alveolar air is replaced by cellular exudate and transudate. Pneumonitis, localized inflammation of the lung parenchyma due to non-infectious causes like chemicals, as for example kerosene, or allergic interstitial lung inflammation. Bronchopneumonia, this is primarily a spreading inflammation of the terminal bronchioles and their related alveoli. Community-acquired pneumonia. Pneumonia acquired in the community due to specific organisms, as for example Streptococcus pneumoniae. Hospital-acquired pneumonia. Pneumonia acquired in the hospital usually involves compromised subjects and is caused by a wide variety of microorganisms. Ventilator-associated pneumonia. Pneumonia that occurs in people who are on mechanical ventilation in hospitals. Typical pneumonia. Pneumonia caused by Streptococcus pneumoniae. Atypical pneumonia. That pneumonia does not behave like typical pneumonia. Why pneumonia is important for learning? You see, the under 5 cause of death. The mostly this is neonatal, almost 48%. And pneumonia, the single disease, accounts for 16% of total mortality. And no other single disease is responsible for such a magnitude of death in under 5 children. More than 80,000 deaths are occurring due to pneumonia in a single year throughout the world. And pneumonia affects mostly the developing countries. You see, this is India, Bangladesh, Pakistan, and some countries of the African zone. Now, the risk factors of pneumonia. The few risk factors: inappropriate IYCF, infant and young child feeding; overcrowding; indoor pollution; malnutrition; and less care-seeking behavior. We are coming in details. Non-breastfeeding enhances mortality by 6.3 times. If a child is not breastfed, the chance of death from pneumonia increases significantly. Also, the child is mixed feeding, that is breastfeeding and formula feeding, the chance of mortality from pneumonia also increases. Prelactal feeding and early weaning significantly increases the chance of pneumonia. So pneumonia is important if there is inappropriate feeding. And the overcrowding is also important for causing pneumonia. In Bangladesh, 77% households, there are 4 to 5 persons live in a single room. Overcrowding significantly enhances pneumonia attack. This is indoor air pollution, charcoal or wood fumes resulting from indoor cooking dangerously harm child's airway and lungs. Indoor air pollution hampers mucociliary functions and cellular immunity of respiratory tract and increases pneumonia, morbidity, and mortality. And this is malnutrition. Malnutrition is identified among 70% of children with pneumonia. Malnutrition increases pneumonia mortality by 3 times. And less care-seeking behavior. Pneumonia mortality was found significantly lower among children who consulted health workers earlier. In Bangladesh, early care-seeking was noted among mothers who are SSC passed. So you are very lucky, you are highly qualified. In future, you will be seeking medical consultation if your child sick. Now, etiology of pneumonia. This is age-based etiology. Neonate, infant, 1 to 12 months, 1 to 5 years, and older than 5 years. I would request you to concentrate on this 1 to 12 months, and the important causes are viruses, RSV, and just remember 3 bacteria: Staphylococcus pneumonia, Haemophilus influenzae, and Staphylococcus aureus. These 3. Just again, Staphylococcus pneumoniae, Haemophilus influenzae, and Staphylococcus aureus. And in older children, this is mycoplasma and tuberculosis in all ages. Now, pneumococcal diseases can be divided into invasive pneumococcal disease and non-invasive pneumococcal disease. You see, there are a lot of invasive pneumococcal diseases. Just you remember bacteremic pneumonia, and there are other non-invasive pneumococcal diseases. The spectrum is wide. Now, pathogenesis. The organism is aerosol based, and this is carried to the nasopharynx where this is colonized, and then this is transmitted down to the lungs. Nasopharyngeal caries may occur in up to 60% of healthy preschool children. Pneumococcus virulence and the body's immune response produce four key effects after entering into body through nose. These are adhesion, invasion, inflammation, and hypoxemia and shock. And it is characterized by four stages. First stage is stage of congestion. Alveoli are filled up with serous fluid. Second stage of red hepatization. Inflammatory cells, red cells, and pathogens are components of this fluid and cells. Third stage of gray hepatization. Here neutrophils and fibrins are packed into the alveoli. And the final or fourth stage of resolution. Macrophages eliminate the organisms and the remaining residue. Now the clinical features. History and examination. In history, we're looking for age, fever, cough, respiratory distress, breathing difficulty, chest pain in older child. Physical examination, inspection, palpation, percussion, auscultation. Inspection, you see the tachypnea, signs of respiratory distress, starting from flaring with alanesi, suprasternal recession, intercostal recession, chest indrawing, and restricted chest movement on the affected side, and sometimes cyanosis in severe cases. Palpation. There is central trachea, apex with normal position, percussion, dull on percussion on the affected side, and auscultation, bronchial breath sound, increased vocal resonance, and crackles on the resolution phase. So this is very important. We ask students in examination, they tell the physical examination findings of consolidation, inspection, palpation, percussion, auscultation. Now this is an instrument called pulse oximeter. This is for indirectly monitoring oxygen saturation in blood. This is very important for assessing a child with respiratory distress, either pneumonia, bronchiolitis, or asthma. Investigation, we advise total blood count, peripheral blood film, C-reactive protein, there is a neutrophilic leukocytosis, and blood for CS. In very few cases, you can isolate the organism. X-ray chest, consolidation or pathogenesis, pleural fluid examination. This is physical and cell count, biochemical, and for antigens of pneumococcus and Hemiplasma fungi. And you can do the culture of pleural fluid and CT scan of chest in difficult and complicated cases. You see the consolidation on the right side. The child of 6 months, and this X was done on the 1st November, the child, and this is the X-ray and follow-up on 11th November. Just you see there is clearing of its consolidation, and this happens mostly in cases of Staphylococcus pneumoniae. Now the treatment. Treatment: general, supportive, specific. Hospitalization: if there is severe respiratory distress, feeding difficulty, and hypoxemia, that is, with the pulse oximeter, if you find the oxygen saturation below 90%, that is, the child is severely distressed, and hypoxemia. And counseling, what to tell the parents about the disease. Pneumonia is infection of the lungs, which are inside our chest, and these lungs supply oxygen to our body from the environment. And there is excellent prognosis with early erosion of appropriate treatment. Feeding, if the child can afford, you can advise feeding normal or breastfeeding or NGT feeding or IV fluid if not able because of severe respiratory distress. Supportive oxygen inhalation or pharyngeal suction. Specific treatment is antibiotics. We usually target the organism Streptococcus pneumoniae and H. influenzae and Staph aureus. So we give ampicillin combination of with cloxacillin. We can give cephradine either oral or parenteral, or in difficult cases we can start in ceftriaxone, or in atypical cases we can give azithromycin or clarithromycin. And this is the oxygen therapy by nasal cannula and through mask. And the complications of pneumonia. Complications in pneumonia, you should start from the lungs, the pleurisy, pleural effusion, empyema, thoracis, pneumothorax. And in the lung parenchyma, lung abscess and bronchiectasis. And then come to the heart, is endocarditis, myocarditis, and pericarditis. And the blood septicemia, brain meningitis, gut peritonitis, even paralytic ileus, and bones and joints osteomyelitis or septic arthritis. The pneumonia course and prognosis. Most children recover rapidly and completely within 7 to 10 days if the treatment is started early with effective antibiotics. Radiological features return to normal within 4 to 6 weeks. It takes longer time than the clinical recovery. Recurrent pneumonia should be evaluated for immunodeficiency and underlying disease. The prevention of pneumonia, if you consider the risk factors. So ensuring optimum nutrition by proper breastfeeding, exclusive breastfeeding for 6 months, and then complementary feeding after 6 months. Along with breastfeeding, we have to avoid crowding, we have to avoid indoor air pollution, and we have to ensure vaccination against influenza influenzae, type B, and pneumococcal vaccine. Now, the differential diagnosis, most important is bronchiolitis. A child coming with runny nose followed by respiratory distress, and the child is below 2 years, and you see on X-ray there is hyperinflation and increased translucency, that is bronchiolitis. And asthma, this is a child coming with recurrent respiratory distress with wheeze, and that responds to bronchodilator therapy. And you can find other atopic conditions in the child like allergic rhinitis, allergic conjunctivitis, and eczema. Now, for you, some questions on pneumonia, important in written examination and also for viva. What is the case definition of pneumonia? Fever, signs of respiratory distress, coarse speckles on auscultation, and X-ray shows consolidation. What is Lobar pneumonia? Inflammation of pulmonary tissues with associated consolidation. What is community acquired pneumonia? Pneumonia acquired in the community due to specific organisms, viruses or Streptococcus pneumoniae. What is bronchopneumonia? Primarily a spreading inflammation of terminal bronchioles and the related alveoli. What are the risk factors of pneumonia? Inappropriate infant and young child feeding, overcrowding, indoor pollution, malnutrition, and less care-seeking behavior. Name 3 important bacterial causes of pneumonia. This is very important. Frequently asked in examination. Streptococcus pneumoniae, Influenza influenzae, and Staph aureus. I again repeat. Streptococcus pneumoniae, Influenza influenzae, and Staph aureus. Name 3 presenting features of pneumonia: fever, cough, and breathing difficulty. What are the chest features of pneumonia? If you are asked, you should say inspection, palpation, percussion, and auscultation. Inspection is trachea and tachypnea, chest indrawing, restricted chest movement, cyanosis. Palpation, central trachea, and percussion, dull on percussion. Auscultation, bronchial breath sound, and increased bronchial resonance. Name 3 investigations for pneumonia. Blood count shows neutrophilic leukocytosis. X-ray chest shows lobar consolidation, and sometimes blood CS can isolate the organism, or pleural fluid can isolate the antigens of pneumococcus or influenza influenzae. Name 3 modalities of treatment for pneumonia: oxygen inhalation, antibiotics, paracetamol suspension, and chip feeding. Name 3 complications of pneumonia. Complications: lung complications, heart complications, blood, and others. Pleural effusion, pneumothorax, heart myocarditis, and brain meningitis. How will you counsel mother about pneumonia? Pneumonia is infection of the lungs, located in the lungs, chest. And these lungs supply oxygen to our body and exhales carbon dioxide from our body. An organism, a bug, affects the lungs, and that causes the pneumonia, respiratory distress, cough, and all other features. And with treatment, the prognosis is excellent. Appropriate treatment, if you can give with good antibiotics, the prognosis is very good. Now, thanks to you all for your kind attention in this time of COVID pneumonia. You have to wear masks, maintain social distancing, hand washing, and stay at home.